Yes, you! Have you recently noticed symptoms such as a fever, unexpected loss of weight, loss of energy, a consistent cough with or without traces of blood, and night sweats?
Yes?
If you answered yes, then you may have tuberculosis. Tuberculosis is a highly infectious bacterial disease that infects 1/3 of the world population each year.
So what exactly is tuberculosis?
Well, tuberculosis, also referred to as TB, is caused by a pathogen called Mycobacterium tuberculosis, aka MTB. These specific bacteria are called obligate aerobes, meaning that they grow successfully in high oxygenated tissue, such as areas in the upper lungs.
Huh?
Well, to make it easier, the process of tuberculosis can be broken down into 3 easy stages. Stage 1. The transmission of this disease is possible through contact with an infected individual. TB occurs when the infected person coughs and releases droplet nuclei containing the infectious Mycobacterium tuberculosis pathogen into the air, which can be suspended for several hours. Infection occurs if inhalation of these droplets results in the organism reaching the air sacs inside the alveoli of the lungs where the infection begins. Stage 2. After being in the air sacs for 7 to 21 days, the pathogen multiplies throughout the body, causing damaging inflammation to the lungs, resulting in the chesty and consistent coughing, and in time may cause traces of blood to appear when coughing. Stage 3. The initial host response can be completely effective and kill all bacilli. However, at this stage tubercle formation begins, which is of a cheesy consistency. The bacterium continue to multiply and may be too powerful for the activated macrophages to kill them. However, MTB cannot multiply within these tubercles because of the low pH environment. But when they start to liquefy, it becomes a stronger conductor for MTB to rapidly multiply extracellularly. The large antigen buildup results in the bronchi walls to rupture and allow MTB to spread to other parts of the lung or even invade other organs and blood supply lines.
Oh my gosh, so now that I may have TB, what do I do?
Listen carefully. It is crucial to seek immediate medical advice as soon as symptoms arise to prevent the spread of disease as it is transmitted via the air. Once a medical professional has diagnosed you with TB and medications are prescribed, it is important to stay in hospitalization quarantine to prevent the spread of the disease and to monitor any progress. Mouth masks should be worn to prevent the bacterium present in the air. These steps must be taken to control the situation.
Phew! So TB can be cured.
Yes, if you follow the strict antibiotic regime, it is possible for TB to be cured. The treatment of TB lasts for approximately 6 to 9 months of a combination of antibiotics, usually isoniazid and rifampicin, which needs to be closely followed. Isolation is crucial while still infectious, as it is a communicable disease.
What if I can't be bothered to take the medication? It's so long.
Good question. Well, multi-drug resistant TB is caused by inconsistent treatment that occurs when patients do not take all their medicines regularly for the required period, or doctors prescribe the wrong treatment regimes, or because the drug supply is unreliable. The result of not taking the required medications properly, the TB becomes resistant to the isoniazid and rifampicin, the 2 most powerful anti-TB drugs. Although drug-resistant TB is generally treatable, there are 2 options available: chemotherapy and surgery. The extensive chemotherapy requires up to 2 years of treatment with second-line anti-TB drugs, which are more expensive and have shown to give more severe effects. Surgery may involve the removal of the TB-infected area of the upper lungs, which is a long process in terms of recovery. So don't ever miss a single dose to avoid TB becoming resistant to antibiotics.
One more thing. I don't want my friends to getting TB. What can we all do?
It's simple. Just remember to practice good hygiene regimes such as frequently washing your hands and avoiding close contact with people, especially those who are coughing. You may never know if they are carrying the TB disease. Also, lead a healthy lifestyle by eating right and exercising to strengthen your immune system and combat the disease. Finally, getting vaccinated for TB will prevent you from contracting the disease, which is by far the best strategy of prevention.
Wow, thanks for the help, you random.
Glad to help.
Authorised by the Australian Government, Canberra.